Nurse Aide CNA Exam Practice Test 2025 Hardest 40 Real Questions Answers. Question 1. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the one way to prevent infection spread. Question 2. A resident is in isolation. What is done with their linens? Double bag them, wash in the sink, throw them away, shake them out. Double bagging or special handling per facility policy. Question 3. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 4. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 5. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 6. The normal adult pulse rate is 40-60 bpm, 60-100 bpm, 100-120 bpm, 50-90 bpm. 60-100 bpm is the normal range. Question 7. A resident falls. What is your first action? Help them up, call for a nurse, move them to bed, give them water. The nurse must assess for injury before moving the resident. Question 8. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent backflow/infection. Question 9. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 10. When feeding a resident, you should rush them, offer small bites and wait, use a straw for everything, talk to other staff. Prevents choking and promotes dignity. Question 11. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 12. How often should a resident be repositioned? Every 4 hours, once a shift, every 2 hours, once a day. Standard is every 2 hours to prevent pressure sores. Question 13. Post-mortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 14. A resident refuses a bath. You should force them, respect their refusal and report it. Call their family, tell them they smell. Residents have the right to refuse treatment. Question 15. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 16. How should you identify a resident? Ask their roommate, check their room number, check their ID band, call them by name. ID band is the standard identifier. Question 17. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 18. A resident is choking and cannot speak. What should you do? Wait for help, perform abdominal thrusts, offer water, hit their back. Abdominal thrusts Heimlich for complete obstruction. Question 19. Which of these is a sign of skin breakdown? Redness that doesn't go away, tan skin, dry skin, freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 20. What is the first step when discovering the fire? Rescue residents, activate alarm, contain fire, extinguish. Race protocol starts with rescue.